Welcome to the weekly dose of self-care presented by your neighborhood pharmacist. Today, we're going to learn about how to manage diabetes when you're sick in just 5 minutes. When you're sick, it is very important to check your blood sugar more often, like every 2 to 4 hours, just because your sugar can become unpredictable. Remember to continue drinking water or sugar-free fluids. And if you have been drinking coffee or tea or pop, make sure you avoid those because they will cause you to lose more fluids from the body. And if you have no appetite, then you can replace solid foods with liquid nutrition that I will mention a bit later. And if needed, depending on your blood sugar, try to consume 15 grams of carbohydrate every hour. You might be tempted to use medications to help your symptoms when you have a cold. And if you do, make sure you select sugar-free medications or medications that do not spike the blood sugar. And it is also very important to continue using insulin while sick, although you might need to adjust the dose a bit. The reason for that is insulin is not only there to help control the blood sugar, but there's also other reasons why our body needs it. And if you don't use it, sometimes it might lead to a diabetic emergency. If you're sick, you have diabetes, and you have a cough, then just look for a box that says sugar-free for cough control. Now, if you have stuffy nose, make sure you use a nose spray Zyrtec instead of taking the tablet Reactine. If you have pain or fever, make sure you use Tylenol instead of Advil, just because Advil is not great when you're not eating or drinking properly. If you have constipation from not drinking or eating enough water, then you can use Metamucil to bulk up the stools to make sure you want to go. But make sure the one you grab says sugar-free. Now, if you start vomiting and you have diarrhea greater than 2 times in 4 hours, then it's very important for you to go to the emergency because you may have some signs of a diabetic emergency. If you can't eat solid food, then you can get your nutrition from this Boost liquid nutrition supplement. And make sure you choose the one that says for diabetic. Having diabetes does not mean that you can't have any sugar at all. Here are some Splenda and Stevia. These are artificial sweeteners that give the sweetness without raising the blood sugar. You might be more likely to get a low blood sugar because when you're sick, you tend not to eat or drink as much. Or you still use too much insulin, or you're still on taking the oral diabetes medication. So a low blood sugar reading is considered when it's less than 4. Some signs of a low blood sugar may include some nausea, feeling tired, feeling hungry, shaking, and if it happens at night, you can get sweating. When you feel the symptoms that I had described, or if your reading is actually less than 4, make sure you eat 15 grams of sugar-containing food. And after you treat it, retest it again in 15 minutes to make sure that the blood sugar is now greater than 4. So how much is 15 grams of sugar? You can use the following methods. Either you can buy a DETS-4 tablet, which is a commercial product where 1 tablet gives you 15 grams of sugar. Or if you don't want to buy a commercial product, you can just dissolve 3 packets of sugar in water, or you can drink 1 cup of milk, or 1 tablespoon of honey. It's important to know that your driving skills, such as your responsiveness, your decision making, drops when your blood sugar is less than 4. And even if you treat it, it will take 45 minutes after you treat the low blood sugar before your body returns to its normal state. If you're driving long distance, make sure you check your blood sugar every 4 hours or earlier if you have symptoms. If you like what you're hearing, remember to like and subscribe and turn on notifications. Comment below for any suggestions to the channel. I'll see you next Saturday at 8 p.m. Bye!